Essential Case Manager's Guide, the Comprehensive Assessment. Welcome to Module 2, the Comprehensive Assessment. Just to review, in Module 1, we talked about when a case manager is first assigned to work with a client through the initial face-to-face meeting. In Module 2, we will review the components of the comprehensive assessment, understand the expected time frames and business rules, recognize the ways that the comprehensive assessment relates to the individual service plan, locate and access the documents needed to complete the comprehensive assessment, identify risk and trauma-related information specifically. Each section of the comprehensive assessment should be filled out completely. Discussion will focus on the descriptors as a guide as to what information is needed. We will use a hypothetical case to illustrate correct application of information. Please print out a blank copy of the comprehensive assessment to follow along with this training. This is a long training. We would prefer for you to pause and take a break instead of just powering through and not absorbing the material. Let's meet Jane Smith. I will be following her as her newly assigned case manager and piece together and write the comprehensive assessment based upon document reviews and interviews with Jane and her collaterals. I was assigned Jane Smith on 7/26/21. I, as the case manager, have reviewed all the records and have had phone conversations with Jane's therapist at Bridgewell, Sally Lee, as well as Jane's brother, John Smith. I have also met face-to-face with Jane Smith on 7/31/21, 8/6/21, and 8/14/21 prior to completing the comprehensive assessment on 8/20/21. The comprehensive assessment was completed within the 20-day business timeline. By working with Jane Smith to complete the comprehensive assessment, the two of us have also developed a draft ISP together that can be used as a working document for the initial ISP meeting. As you will see, the comprehensive assessment informs the ISP. As we review this comprehensive assessment, you will realize that in this particular case, the case manager was fortunate to have an eligibility file that contained a good deal of information. Jane Smith was very willing to meet with the case manager as well as sign releases. The therapist and Jane's brother were also available to share their perspectives. This will not be the case for every client that you are assigned, and your comprehensive assessment sections will not be as detailed as Jane Smith's. It is also important to note that as you review the records that are available, you may find inconsistencies in the various records. It is important to note these inconsistencies and to check in with the client and collaterals to assure what information is accurate. The case manager obviously wants the comprehensive assessment to be as accurate as possible. Perhaps the most important section of the comprehensive assessment is Part 4, Goals and Needs Assessment, subsection Risk Needs. It is extremely important that a case manager identify all historical and current risk areas and work with the client in identifying interventions, services to mitigate those risks. The Community Risk Identification Tool, as well as the Risk Review Summary, should be thoroughly reviewed and explored with the client as well as collaterals. It is entirely possible that the case manager may discover other risk areas that have not been identified. If a client acknowledges a trauma history and trauma symptoms, the case manager should be careful not to delve too deeply into the client's history of trauma. The case manager should work with the client by making referrals to trauma-specific services. I just wanted to say that after completing the comprehensive assessment on this hypothetical case, I have a greater appreciation for the time and work that is required of a case manager when they begin their work with a client. While I was a DMH site director, I often heard of the time and effort required of a case manager when a new client was assigned. I now realize just how much time and effort is needed from a case manager to complete the comprehensive assessment within 20 business days. Now, on to Jane. Comprehensive Assessment Part 1, Persons, Strengths, and Goals. Self-description. Briefly summarize how the individual describes himself/herself, including age, gender, race, ethnicity, language, as well as culture, religion, and/or other personal values or beliefs. This is an example of how you would complete the comprehensive assessment form for this first section. Going forward, please follow along with your blank comprehensive assessment form, as the examples I will show are too large to fit on a screenshot. Jane Smith describes herself as a smart and honest woman who cares about other people. She identifies as a 36-year-old single white female of Irish descent. Jane said she was raised as a Roman Catholic, but since she turned 18, she really has not been an active member of the church. Jane says she usually only attends Christmas Eve and Easter services with her mother and brother. Jane's preferred and only language of communication is English. Self-defined goals. Identify goals and preferences expressed by the individual, legally authorized representative, and/or family if applicable. Briefly describe how DMH can be most helpful in obtaining these goals and whether the person feels hopeful about achieving his or her goals. Jane currently lives in a rooming house in Lowell, Mass. She says her SSI check barely covers the rent, and her brother John regularly gives her money for food, other necessities, and spending. Jane says the rooming house is not in a safe area of the city, and she does not go out at night. Jane would like help applying for subsidized housing so that her rent is not such a burden and so that she can move to an area in Lowell that she feels safe in. She would also like assistance in applying for SNAP benefits so that she does not feel as much of a financial burden on her brother John. Jane describes herself as being in reasonably good health and would like to continue with her 6-month visits to her PCP. She would also like to maintain her appointments with her psychiatrist and therapist and plans to continue with medications her psychiatrist recommends. Jane would like to continue with regular eye exams with her current doctor, but she would like to change where she receives dental care as she does not like going to her current dentist. Jane says she is interested in returning to the workforce and obtaining a part-time job. She is interested in exploring whether Renaissance Club is a potential vocational support. Jane says due to limited finances, she walks everywhere and is interested in assistance in applying for a reduced bus fare pass through the Lowell Regional Transit Authority. Jane states that she continues to struggle with alcohol use and that she finds attending AA meetings helpful. The meetings also give her a chance to socialize with others. Jane says that even though she has many goals, if she receives assistance from DMH, she is hopeful of achieving these goals. DMH can assist Jane in accomplishing her goals by providing coordination of care on a regular basis. Identify strengths. Consistent with the beliefs of help-seeking patterns of the individual, legally authorized representative, and family. Identify the strengths, assets, and resources, including complementary and alternative medicine, available to the individual to assist in addressing the goals identified above. Jane is a friendly and engaging person who is eager to obtain additional support services to achieve her goals. She fully utilizes the psychiatric, medical, dental, optical, and substance use support services that she currently has. She has emotionally supportive family relationships with her mother and brother, and her brother is also financially supportive. Jane has a BA in Business Administration and has had 6 years workplace experience as a receptionist. She is motivated to secure employment and reports working well with both supervisors and co-workers. She maintains positive professional and personal relationships. Despite her low income, Jane assures that her rent is always paid on time. Self-perception. Briefly describe the individual's perception of his or her illness and current situation. Jane describes her mental illness as an overwhelming sadness and total lack of energy that can last for weeks and even months. Jane says that the vast majority and intensity of her symptoms are controlled with the medications her psychiatrist prescribes and if she remains sober. If she starts drinking, the overwhelming sadness and lack of energy returns, even though she continues taking her medications. During these times, she will mostly stay in bed, not shower, and not even have the energy to eat. On 2 occasions, she became so sad and hopeless that she wanted to take her life and tried to do so by overdosing on her psychiatric medications and alcohol. Jane states she is thankful she is still alive and does not want to reach that point of hopelessness again. Jane says that she lacks the confidence to try new things by herself and needs assistance initially. She states that all of the services she has now are a result of her brother helping her obtain them. Jane does not want to burden him further and would like the support of DMH to obtain additional services. Jane feels that her financial and housing situations are major causes to her feeling some symptoms of depression despite adhering to her medication regime and remaining sober. Purpose of DMH intervention. From the case manager's perspective, describe why DMH intervention is needed at this time. Jane currently lacks the confidence to obtain new services independently and does not want to further burden her brother with this task. When Jane was referred to DMH services, she was psychiatrically hospitalized following a medication and alcohol overdose. Jane will benefit from having ongoing assistance and support in applying for subsidized housing, SNAP benefits, and a reduced bus fare pass. In addition, she will benefit from assistance in obtaining a new dental provider, as well as connecting with the Renaissance Clubhouse. In the future, Jane may benefit from assistance in connecting with the Lowell Recovery Learning Community to increase socialization and mass rehab to further pursue vocational goals. Barriers. Identify any barriers that may make it difficult for the individual and/or family member or legally authorized representative to attain his or her goals, including cultural and linguistic barriers, example, limited English proficiency, immigration status, low literacy. Jane is highly motivated to obtain the additional benefits and services as noted above with the assistance support of DMH. Jane currently lacks the self-confidence needed to independently obtain additional benefits and services. Even though she is fearful to try new things, after she initially receives support, she is able to follow through independently. SNAP benefits, a reduced bus fare pass, and Renaissance Clubhouse enrollment can all be obtained in a timely manner. DMH can assist Jane in applying for subsidized housing, but the wait list for these subsidies may take several years. Another local dentist who accepts Mass Health and is accepting new patients will need to be identified. Since most of Jane's income is spent on her rent, she does not have the money to participate in leisure activities or to cover unexpected expenses. Also, because Jane feels unsafe in her neighborhood, this tends to cause her to isolate more than she would like. Supports ISP goals to assist with goals, strengths, or barrier needs. Yes. Comprehensive Assessment Part 2, Developmental and Treatment History. Early Development. Summarize the individual's early developmental history, family life, and pertinent family history. Include any history of learning difficulties, barriers to learning, and any special communication needs. Jane reports that her childhood was mainly a good one. Her oldest brother, John, was always good to her and looked out for her. Jane reports her mother was a caring and supportive parent. She reports a good relationship with her father when he was sober. She stated that 2 or 3 times per year he would stop attending AA and start drinking. During these times, Jane stated that her father would be angry and always wanted to get into verbal arguments with her, her mother, and her brother. During these times, he would drink at home after his workday. These occasions would last for 2 to 3 weeks and ended when he and Jane's mother would get into a huge argument that resulted in her father returning to AA and remaining sober for a period of time. Her father died of a heart attack in 2005 when Jane was 20 years old. Mental illness is prevalent in Jane's family. She has a maternal aunt who has been treated on an outpatient basis for anxiety and depression for at least 20 years. Jane reports that her paternal grandmother was hospitalized on at least one occasion when Jane was a teenager. Her parents did not like talking about this with her or her brother. Jane reports doing well in school from kindergarten through high school. She was pretty consistently a B student and was involved in the drama club and junior cadet corps in junior and senior high school. Jane describes herself as having many friends in elementary through high school. She graduated from Lowell High School in 2003. Onset of illness. Summarize the circumstances and approximate age of illness onset. Jane reports that her father died in her junior year of college and that she had a tough time with his death. This was the first time she recalled feelings of mental illness, depression. She often overslept during her junior and senior years and would frequently miss classes. Before her father's death, she was consistently attending her classes, doing her work, and socializing with friends. During the college, this sometimes involved using alcohol and marijuana on Friday nights. Jane noted that she did not feel the alcohol and marijuana use was problematic at the time. After her father's death, Jane did not socialize very much with her friends and mainly went straight home after class, if she went to class. She would mainly stay in her room when she was at home and watch TV. Despite this, Jane did earn her Bachelor of Business Administration in May 2007. Jane reports that after graduation, she did not have the energy to look for a job until her mother told her she needed to find a job by May 2008. Jane found a job as a full-time receptionist in a doctor's office in Lowell, Mass. In April 2008. Jane reports that her job went well for the first 3 years and that she was beginning to feel better about her life. However, in 2011, she moved into a studio apartment by herself and began to struggle with depression. Jane states that when she moved out on her own, she started to feel lonely and sad. She would come home from work and often go right to bed. During 2014, she began drinking after she came home from work and would often go into work late or just call in sick. This eventually led to her dismissal from her job. Jane moved back into her mother's house in 2014 after she was terminated from her receptionist job. Jane mainly stayed in her bedroom and slept about 12 hours per day. During the evenings, she often drank at least a bottle of wine. Jane states that she became more and more hopeless about her life. Jane's brother helped her get involved with Bridgewell Counseling in Lowell, Mass. In November 2014. She began seeing a therapist and psychiatrist there and was prescribed medications for depression. Despite taking the medications her doctor recommended, she continued drinking, and in January 2015, she tried to take her life by taking all of her prescribed medications and drinking heavily. This led to her first psychiatric hospitalization at Holy Family Hospital in Methuen, Mass. In January 2015. She has remained engaged in treatment at Bridgewell. Outpatient and substance use history. Summarize outpatient mental health and/or substance use services. Describe those services that were most and/or least helpful from the individual's and/or provider's perspective. If there is not a substance use history, state that fact. Jane has received both therapy and psychopharmacological services since November 2014 from Bridgewell Counseling in Lowell, Mass. Jane reports that despite frequent staff turnover at Bridgewell, she is satisfied with the services she receives there and has attended most of her scheduled appointments. Jane finds the medication she is prescribed for her depression helpful most of the time and when she remains sober. Jane began attending AA meetings in February 2015 after being discharged from her first hospitalization at Holy Family Hospital. Jane finds AA very helpful to aid her to remain sober. She had been attending 4 to 5 meetings per week since February 2015 until COVID hit in March 2020. Jane reports that since her discharge from Holy Family Hospital in June of 2021, she has begun attending AA meetings again. Jane reports that even though she used marijuana in college, she has not used it since she graduated in 2007. Community Support Service History. Summarize community support services. Describe those services, including past residential services, that were most and or least helpful from the individual or provider's perspective. Besides Bridgewell counseling and AA meetings, Jane has not received any other community support services until July 26, 2021, when she was authorized to receive a DMH service, specifically case management, and this case manager was assigned. Inpatient mental health and substance use history. Summarize inpatient mental health and or substance use services. If the individual does not have a substance use history, state that fact. Describe those services that were most and or least helpful from the individual's and or provider's perspective. If the individual has been hospitalized multiple times, it is important to discuss the specifics of their first and last hospitalizations. If the individual has had, as an example, 5 additional hospitalizations with similar circumstances, it is not necessary to discuss each hospitalization. Instead, after discussing the first and last hospitalization, it is acceptable to state that in addition to these 2 hospitalizations in the last 10 years, the individual has had 5 additional hospitalizations with similar circumstances. However, if the individual was hospitalized under entirely different circumstances, that particular hospitalization should be discussed in greater detail. Jane had her first psychiatric hospitalization from January 3, 2015 through January 24, 2015 at Holy Family Hospital in Methuen, Mass, following a suicide attempt on her prescribed medications and alcohol. Jane's mother walked into Jane's bedroom after Jane did not respond to her mother knocking on her door. She found Jane unconscious in her bed with an empty bottle of her prescribed medication, Wellbutrin, and an empty bottle of wine on the floor by her bed. Jane stated that there were about 10 days' worth of medication in the bottle. She had been prescribed Wellbutrin, 100 milligrams twice per day at that time. Jane's mother called 911, and Jane was taken by ambulance to Lowell General Hospital. She did not require a medical inpatient hospitalization, but it was determined that she required a psychiatric hospitalization, and Jane was transported to Holy Family Hospital. Jane found this hospitalization helpful, particularly due to the substance use groups on the unit, and also because her social worker talked to her and her brother in family meetings about AA and how these meetings would be helpful. Jane began attending AA with her brother's support after she was discharged from this hospitalization. Jane had her second psychiatric hospitalization at Holy Family Hospital from June 5, 2021 to June 19, 2021, following a second suicide attempt on her prescribed medications and alcohol. Jane's brother had come to pick Jane up at her rooming house for weekly grocery shopping. When Jane did not answer her door, he gained entry by using the spare key Jane had given him. Jane's brother found Jane unconscious on her bedroom floor with an empty bottle of her prescribed medication, Wellbutrin, and an empty bottle of wine beside her. Jane stated that there were about 6 days' worth of medication that she had taken. She had been prescribed Wellbutrin 100 milligrams twice per day at the time. Jane's brother called 911 and she was taken by ambulance to Lowell General Hospital. Even though a medical inpatient hospitalization was not required, Jane was transported to Holy Family Hospital for an inpatient psychiatric hospitalization. Jane found this hospitalization very helpful because the social worker talked to her about Dmh services. Jane said she had felt so lonely the past year and was hopeful that she would receive some support services to help her feel more optimistic about her life. Jane has not received any substance use inpatient services and has instead relied on attending 4 to 5 AA meetings per week since January 2015. Jane reports that AA has helped her remain sober for over 5 years. It was only after COVID hit in March 2020, when she was afraid to attend meetings, that she relapsed on alcohol. Current and past diagnoses and symptoms. Summarize current diagnoses, diagnostic history, and symptoms. The most recent diagnoses noted on the data sheet. It should be noted that the current Diagnostic and Statistical Manual of Mental Disorders, DSM, is the DSM-5. However, there are clinicians who are still using the DSM-4 or DSM-4-TR. When you are reporting an individual's diagnoses as reported by a clinician, record it as the clinician has documented it. Jane's most recent diagnoses, May 2021, per Dr. Small of Bridgewell Counseling. Axis 1, major depressive disorder, alcohol use disorder. Axis 2, deferred. Axis 3, hypothyroidism, high cholesterol. Jane's diagnoses have remained consistent since her mental health treatment began in November 2014. Jane said when she is depressed, she can feel an overwhelming sadness and total lack of energy. She will stay mostly in her bed and sleep 12 hours per day. She does not have the energy to shower or even eat. She has become so hopeless that she has tried to end her life on 2 occasions. Current and past psychiatric medications. Summarize the individual's current psychiatric and/or medical medications, if any, the effectiveness of the medications, history of and current compliance with medications, and history of adverse medication reactions. Jane is currently prescribed Wellbutrin for depression. She reports that she consistently takes the medications her psychiatrist, Dr. Small, prescribes. Jane said, for the most part, this medication is effective if she remains sober. She still sleeps 9 to 10 hours per day and sometimes has difficulty getting up, but she does rise and go forward with her day. When Jane first started at Bridgewell in November 2014, her psychiatrist had prescribed Celexa for her depression, but Jane reported to experience severe headaches several times per week when taking Celexa. Her psychiatrist discontinued this medication and recommended that Jane start Wellbutrin in December 2014. She has been prescribed Wellbutrin with positive results since that time. Jane is currently prescribed levothyroxine and atorvastatin by her PCP, Dr. Jones. The levothyroxine is for hypothyroidism, and the atorvastatin is for high cholesterol. Jane has been treated for both of these medical conditions since January 2018. She reports that both conditions are effectively controlled with these medications, which she reports taking regularly. She sees Dr. Jones twice per year and has blood work taken prior to these appointments. Comprehensive Assessment Part 3, Social Home Environment. Key interpersonal relationships. Summarize the individual's key interpersonal relationships, such as family, friends, significant others, and natural supports like recovery services, self-help groups, religious, spiritual supports. How do the individual's interpersonal skills contribute to the quality of these relationships and his/her social life? Jane has good interpersonal skills. She has effective and clear communication skills, and she demonstrates empathy to other people. She is very comfortable with her family. Even though Jane is initially timid when meeting new people, she is able to build good relationships and work well with others. Jane's strongest interpersonal relationship is with her brother John, who she sees twice per week and speaks to on the phone once or twice per week. John not only is emotionally supportive, but he also helps Jane financially. John takes Jane grocery shopping every Saturday and pays for her groceries. Jane is very thankful that she has her brother. He has always been emotionally supportive and has helped her over the years get involved in support services she has. Jane reports a good relationship with her mother, Dawn. Jane calls her mother twice per week and visits with her on Sundays and helps to prepare Sunday dinner for her, her mother, and her brother, who also comes to share Sunday dinner with them. Jane said that after dinner, her mother and John will sit and talk while she cleans up. Jane gets much emotional support from her AA sponsor, Sally, who has been her AA sponsor since February 2017. Jane and Sally will call each other twice per week. They will talk about their week, and Sally regularly provides words of encouragement to Jane. Jane attends local AA meetings 4 to 5 times per week and finds these meetings essential to maintain sobriety. Jane said that she also enjoys the social aspect of these meetings and will often stay after meetings to talk and catch up with other AA members. Home environment. Briefly describe the individual's home environment, including family or parental obligations. Describe custody status, if any. Jane has been living at the same rooming house in Lowell, Mass. Since February 2016. She said when she first moved in, she felt safe in that area of the city, but during the last few years, the area has become less safe, and she does not go out at night unless someone from AA has agreed to give her a ride home after a meeting. Jane said she usually keeps to herself in the building, except to greet a neighbor if she sees them in the hall. Jane is single with no children, and she does not have any family obligations presently. Significant family and non-family members. List all significant family and non-family members. include their name, relationship to the person, estimated age or date of birth, and frequency and means of contact. Indicate if the person will be involved in the development of the ISP. John Smith, brother, age 40, in-person contact twice per week and phone contact 1 to 2 times per week. Jane would like John to be involved in the development of her ISP. Dawn Smith, mother, age 66, in-person contact once per week and phone contact twice per week. Sally, AA sponsor since February 2017, phone contact twice per week, and will frequently see her at AA meetings. Comprehensive Assessment Part 4, Goals and Needs Assessment. Community Living Skills Needs. Check the appropriate boxes for community living skills needs for individual or family and further assessment of community living skills needed. Community living skill needs for individual or family. For Jane, leisure social activities should be checked. Further assessment of community living skills needed. For Jane, medication management should be checked. Community living skill needs comments. Include a description of community living skill needs identified. Leisure social activities. Jane reports that besides attending AA meetings, she doesn't participate in social activities. She is interested in attending the Renaissance Clubhouse and getting involved in some activities there. Medication management. Even though Jane reports taking her psychiatric and medical medications as prescribed, she has overdosed on her psychiatric medications and alcohol in January 2015 and June 2021. Jane presently feels that she would like to continue taking her medications without the support of a nursing agency. She feels the extra support services she will receive will help her feel more hopeful about her life. Supports ISP goals to assist with community living skill needs. Yes. Risk needs. For Jane, the current risk is not applicable, but for Jane, the historical risk, suicidal, and substance use should be checked off. Further assessment of risk needed. Check not applicable for Jane. Risk needs comments. Include a description of other risk needs identified. For both historical as well as current needs, be sure to use specific dates, including month and year, whenever possible. Suicidal. Jane has overdosed on her prescribed psychiatric medications and alcohol in January 2015 and June 2021. On both occasions, she has felt isolated, alone, and hopeless. She is hopeful that additional support services will have a positive effect on her life. Substance use. Jane began drinking in college. She started attending AA in February 2015 after being discharged from Holy Family Hospital. She reports that she continued attending AA meetings 4 to 5 times per week until COVID hit in March 2020. She returned to attending AA meetings again after her discharge from Holy Family Hospital in June 2021. Jane reported that she had 5 years sobriety before she stopped attending meetings in March 2020. Despite the fact that Jane is not currently suicidal or using alcohol, she did overdose on her prescribed medications and alcohol less than 2 months ago in June 2021. This case manager will be checking in with Jane during each meeting to assess whether Jane is experiencing an increase in depression and whether she is maintaining sobriety. Supports ISP goals to assist with risk needs. Yes. Legal situation and guardianship. Legal situation. Jane does not have a history of any legal situations, nor does she have current charges or release conditions pending. She is not registered in the Sex Offender Registry information, nor is SORI registration needed. Jane does not have CORI issues affecting placement housing. CRA is previously known as CHINS. The CRA order subject pertains to individuals under 18 years old. Guardianship. Jane is her own guardian and she does not need a guardian. Therefore, guardian comments are not applicable. Financial benefits housing section. Financial management subsection. Financial management. Jane does not have a repayee, nor does she need one. Financial management comments. Jane began receiving SSI benefits in February 2016, and she currently receives $825 per month. Jane reports that she immediately pays her rent, which is $800 per month, when she receives her check each month. Supports ISP goals to assist with financial management needs? No. Jane does not need assistance in this area. Assistance needed to obtain or maintain benefits, insurance, or entitlements? For Jane, yes. Further assessment of maintaining benefits, insurance, or entitlements needed? No. Benefits, insurance, entitlements comments will be on the next slide. Benefits, insurance, entitlements comments. Jane states that she often relies on her brother to assist her with any paperwork sent to her regarding her SSI or Mass Health benefits. She has asked this case manager to assist her with maintaining her benefits, health insurance, and entitlements instead of her brother. This case manager will also assist Jane in applying for SNAP benefits and a reduced bus fare pass. Supports ISP goals to assist with benefit or insurance needs? Yes. Housing. Are there any unmet housing preferences? For Jane, yes. Are there any unmet housing needs? Yes. Assistance needed to obtain, maintain, improve housing? Yes. Further assessment of housing needed? No. Housing comments. Jane has lived in the same rooming house in Lowell, Mass. Since February 2016. She reports the rooming house is not in a safe area of the city and she's afraid to go out at night. Also, her rent is $800 per month and her SSI monthly check is $825. She would like safe and affordable housing. This case manager will assist Jane in applying for subsidized housing. This case manager explored with Jane possible benefits of a roommate situation, but at this time, Jane prefers to live alone. Supports ISP goals to assist with housing needs. Yes. Education, adult. Currently receives education services? No. Need or preference for education services? No. Describe educational accomplishments if the individual has completed educational goals. Jane graduated from Lowell High School in 2003 and earned her diploma. She graduated in 2007 from University of Massachusetts Lowell with a BA in Business Administration. Jane does not desire to pursue any further education presently. In the Education Adult section, there is also a subsection for not in school, not a high school graduate. There is also a subsection for adults receiving post-secondary education. Complete the subsection that pertains to your client. Supports ISP goals to assist with adult educational needs. No. As stated previously, Jane is a high school and college graduate, and she currently does not desire to pursue any further education. This is a good time to take a break. For the education section, child, adolescent, up to age 22, I asked Liz Smith, CYF supervisor at the Lowell site, to develop an education scenario and to complete this section for this training. Also, at the end of this module, there's a page with links that Liz provided for more information on special education areas of interest. Child, Youth, and Family Education Scenario. Angie Smith is a 17-year-old female, date of birth 3104, who lives with her biological family in Tingsboro, Mass. She is in the 11th grade due to several years of numerous psychiatric hospitalizations and past school refusal. Her academic performance is below grade level due to difficulty with school attendance and behavioral challenges, for which she receives individual educational plan services through the local school district, who is the assigned legal education authority. Angie has been on an IEP since age 11 and continues to qualify for special education IEP services due to social emotional disability. At the most recent annual team meeting, it was determined that a placement in an out-of-district therapeutic day school is the most appropriate placement to provide services for both her social, emotional, and academic needs. Angie was accepted to the local educational collaborative day school in Billerica, Mass, and has been attending since 9/8/21. Angie's IEP team meeting was held on 5/15/21, and the accepted IEP will be current through 5/15/22. Angie has not passed all of the 10th grade Massachusetts Comprehensive Assessment System, MCAS testing. She passed the English Language Arts requirement, but has not met the requirements for math and science. Education, child adolescent subsection. Currently in school, not high school graduate. Angie's current education level is high school vocational. The name, town of school, local educational collaborative in Billerica, Mass. The local educational authority is the Tingsboro Public Schools. Angie's last grade completed was the 10th. Currently at grade level? No. Attendance is regular? No. She does not have a history of suspension. She does have an IEP. The IEP review date is 5/15/21. If an individual has an IEP, the LEA school district holds an annual IEP meeting prior to the end date of the current IEP. Year Sped Services End. Youth who do not pass MCAS or have not met their IEP service goals are entitled to receive Sped services from the local LEA until they meet said requirements or until age 22, which is considered the Sped termination date. Angie's Sped services end on 3/1/26. Individual has 504 plan. Section 504 is a federal law that protects the rights of students with disabilities in programs and activities, including schools, that receive federal funds. No, Angie does not have a 504 plan. 688 referral filed by LEA. A 688 is typically filed by the school district within 2 years of graduating for a youth who receives special education services. Angie does not have a 688 referral. Individual passed MCAS. Passing the grade 10 MCAS exam is a graduation requirement in the state of Massachusetts. In order to earn a high school diploma, students must receive a score of at least 240 on the grade 10 mathematics and ELA exams and a score of at least 220 on the high school science, technology, and engineering exams. No, Angie hasn't passed the MCAS. Child Adolescent Education Comments. Angie currently receives IEP services due to social emotional disability and attends school in an out-of-school district educational collaborative setting in Billerica, Mass, which she began on 9/8/21. She has passed the ELA MCAS with a score of 246. Supports ISP goals to assist with child-adolescent educational needs. Yes, this is a service need area for Angie. Now, let's get back to Jane Smith. Employment. Does Jane have employment goals? Yes. Involved in volunteer activities? No. Employed but unsatisfied with position? No. Unemployed? Has job readiness skills? Yes. Not employed? Needs employment training? Yes. Currently participating in employment training? No. Has employment history? Yes, Jane does have an employment history. No expressed desire to work at this time? No. Employment comments. If a client does not have an employment history and does not have employment interest at this time, this should be documented in this comments section. Jane has a BA in Business Administration. She worked full-time as a receptionist at a doctor's office in Lowell, Mass. From 2008 to 2014. In her receptionist position, she answered phones, typed, scheduled appointments, and filed. Jane said she worked well with the other employees and she had a strong work ethic until 2014, when, in addition to being depressed, she began drinking and would often go into work late or just call in sick. Jane said she would like to return to work as a receptionist, but realizes she has been out of the workforce since 2014, so she will need some retraining, and is hopeful that the Renaissance Clubhouse will help her with the skills needed to return to work part-time and then eventually full-time. Supports ISP goals to assist with employment needs. Yes. Medical, dental conditions. Medical conditions currently being treated. List any known medical conditions currently being treated. Include such conditions as COPD, chronic obstructive pulmonary disease, diabetes, asthma, known allergies, hypertension, seizure disorder, thyroid abnormality, dental and vision. Medical conditions not treated or unknown treatment. Jane has hypothyroidism and high cholesterol, which her PCP, Dr. Jones, has been treating her for since January 2018. Jane reports that both conditions are effectively treated with medications. She sees Dr. Jones every 6 months, and she has blood work drawn prior to her appointments. Jane has no unknown or untreated medical conditions. Medical conditions needing further review. Are there medical concerns identified by the individual or others that need further review? If yes, describe in the comment field below. No for Jane. Physical exam within the past year. Yes. The date, 3/25/21. Dental exam within the past year. Yes. The date, 2/28/21. Eye exam within the past year. Yes. Date, 1/10/21. Need or preference for services to assist with goals. Does the individual have a need or preference for services to assist with health and wellness goals? Include such health preferences as smoking cessation, weight loss, exercise program, nutrition consult, complementary and alternative medicine in the comment field. Yes for Jane. Primary care physician, Dr. David Jones, 25 Merrimack Street, Lowell, Mass. Phone number 978-459-3223. Dental provider, Dr. William Gray, 100 Bridge Street, Lowell, Mass. Phone number 978-459-8567. Eye care provider, Dr. Jeffrey Tall, 51 Aiken Street, Lowell, Mass. Phone number 978-459-2891. Other healthcare providers include name, location, and phone number of other healthcare providers. There are no additional providers for Jane. Medical dental comments. Jane consistently attends her medical and dental appointments. However, Jane does not like her dentist, Dr. Gray, and she has asked this case manager to help her find a different dentist who accepts Mass Health and who is accepting new patients. Jane stated she will continue with her current dentist until she can begin seeing someone new. Supports ISP goals to assist with medical dental needs. Yes for Jane. Recommended services and contacts. Recommended services. ISP goals. Include recommended services in the comment below. For Jane, you will be checking off community living skills, risk, benefits, insurance, entitlements, housing, employment, and medical dental. Community living skills, leisure, social activities. Jane would benefit from getting involved in activities at the Renaissance Club. Risk. Jane would benefit from continuing to attend her scheduled appointments with her psychiatrist and therapist at Bridgewell. Jane would benefit from continuing to attend 4 to 5 AA meetings a week to maintain sobriety. Benefits, insurance, entitlements. Jane would benefit from assistance in maintaining her SSI and Mass Health. In addition, Jane would benefit from assistance in applying for SNAP benefits as well as a reduced bus fare pass. Housing. Jane would benefit from assistance in applying for subsidized housing. Employment. Jane would benefit from Renaissance Clubhouse vocational supports. Medical dental. Jane would benefit from continuing with her regular appointments with her PCP, eye doctor, and dentist. Jane would benefit and has requested assistance in getting a new dentist. Case management. Jane would benefit from having a case manager assist her in maintaining her current services, as well as assisting her in obtaining the additional services benefits described above. Other agencies involved. List all other agencies involved with the individual, the services being provided, agency contact name, contact information, and whether the agency will be involved in the ISP process. Jane is involved with Bridgewell Counseling, Dr. Amy Small, psychiatrist, 35 Market Street, Lowell, Mass. Phone 978-459-0389. Bridgewell Counseling Services, Sally Lee, therapist, 35 Market Street, Lowell, Mass. Phone 978-459-0389. Jane has requested that Sally Lee be involved in the ISP process. Significant documents used. List all significant source documents and dates. DMH eligibility determination documents, June through August 2021. Bridgewell Counseling, Psychiatric, and Therapy Treatment Plans, May 2021. Holy Family Hospital Admission and Discharge Summaries, January 2015 and June 2021. Case Manager name, Eva Toscano. Date, Comprehensive Assessment completed, August 20th, 2021. Supervisor review and date of supervisor review. Be sure to document in a progress note that the comprehensive assessment was completed and that you notified your supervisor of this so that she can review the completed assessment and document their names and the date reviewed. Comprehensive assessment optional. Additional information and summary. Additional summary 2 through 8. The summary. If the questions in the above additional information section were not completed individually, using interviews and documents available. Provide a narrative summary that addresses each of the items above. If a case manager has completed all of the narrative sections in MHIS as they were completing the comprehensive assessment, these optional summaries will not be necessary. There are case managers who prefer to complete their narrative sections as a Word document so that they can use the spell check function in Word and then cut and paste their narratives into these optional sections. Links for more information on special education areas of interest. Acknowledgements. Liz Smith, Lowell Site, CYF Case Management Supervisor, Educational Section, Child Adolescent up to age 22. The DMH Northeast Area Case Management Training Focus Group, Lynette Accomando from the Lowell site, Deborah Horowitz, Northeast Area Training and Development, Joyce Kazuian from the Acton site, Cecily Long from the Essex North site, Deborah Wimet from the North Shore site, Dee Wimet from the Lynn site, and Michael Woodham from the Metro North site. References. You don't have to be great to start, but you have to start to be great. Zig Ziglar. Thank you.